something a little different from what you were taught earlier. Open the airway and quickly look in the mouth. If you see an object in the mouth, take it out. Do not attempt to reach in and pull anything out that you can't clearly see. This is known as a blind finger sweep. Doing a blind finger sweep may cause the object to become lodged farther back in the airway. Remember, you want to minimize interruptions and compressions to no more than 10 seconds. After checking the mouth, give 2 breaths. Keep repeating the sets of 30 compressions and 2 breaths. Each time you open the airway to give breaths, look for the object in the back of the throat if you haven't already found it. Continue CPR until the person speaks, breathes, or moves, or until someone with more advanced training arrives and takes over.
Any questions with choking? Okay, so again, just Heimlich maneuver, the inward upward thrust right above that belly button until that object comes out. If for whatever reason it does not come out quick enough, because it is occluding the airway, this person will become unresponsive. And then at that point, we're going to do exactly what they said. We're easing them back on the ground, and we're going to begin the thought of doing CPR. Rip open that shirt. We still want to do that step because you still need to know where to place your hands, and you need to still watch the rise and fall of the chest when you're delivering those breaths. So go ahead, rip open that person's shirt, 30 compressions. Right before you go up, tilt the head, to deliver those breaths, look in the mouth. If you see an object, take it out. If you don't, go ahead, pinch the nose. Or if you have your bag mask that we talked about, you want to go ahead, deliver the 2 breaths. Watch the rise and fall of the chest. Go back down, 30 more compressions. Go back up, look again. See if you see the object. If you see it, take it out. If you don't, go ahead and deliver those breaths. Hopefully, at some point by you doing those compressions, you can basically make that object come up, okay, and out of the mouth. But you don't want to do that blind finger sweep. Previously we were taught that it was okay to do that, but what studies have shown is that has caused more damage. Maybe that object was on the way up, you went fishing, feeling around for it, and pushed it back down in the throat. So we just don't want to do that step anymore. If you see the object, take it out. If you don't, deliver your breaths, go right back down, okay? All right, so that'll be a continuous cycle but you got 911 on the way. Okay, at some point you're going to stop and call 911. Anybody who's gotten thrust, like they said, does need to be seen by a healthcare provider. So they will need to come out, okay? All right. Next, we're dealing with water safety.
Drowning and related injuries are a big problem, especially for children. In the United States, drowning is the leading cause of death from unintentional injury in children 1 to 4 years of age. However, there are several steps you can personally take to prevent or limit injuries from drowning. Any person responsible for children around bodies of water needs to be water competent.